Hello, I'm Dr Matthew Checketts and I'm an anaesthesiologist at NHS Tayside, and I want to tell you about the SipTilSend revolution and why NHS Tayside is going to become the first trust to end pre-surgical oral fluid deprivation. Let's go back in history. Joseph Lister, who you will all know as the father of surgical antisepsis, was the professor of surgery at Glasgow Royal Infirmary between 1860 and 1869. And here's a picture of the Lister surgical block as it opened in 1861. He knew a thing or two about anaesthetic and surgical practice, and one of his famous quotes says, "While it is desirable that there is no solid material in the stomach when chloroform is administered, it will be found very salutary to give a cup of tea or beef tea about 2 hours previously." He knew a thing or two, and he knew the importance of avoiding prolonged fluid fasting on the post-operative well-being of his patients. So how did fluid fasting and fasting come into modern practice? It really started after the publication of Curtis Mendelssohn's case series published in 1946 of 44,000 patients having obstetric deliveries. And out of those patients, 66 cases of aspiration of gastric contents were reported by Mendelssohn, the incidence being 0.15%. 2 of those patients died rapidly by solid food materials blocking the airway. The other 64 patients developed symptoms of so-called Mendelssohn syndrome or a chemical pneumonitis, but all made full recoveries within 36 hours. So in the discussion part of that paper, Mendelssohn postulated that fasting might be an idea to reduce the incidence and risk of aspiration. And so, nil by mouth from midnight became normal practice. But the truth is, there is little or no evidence that fluid fasting or even food fasting reduces the incidence of aspiration or the risk. It's unpredictable and is associated with other risk factors. As far as the physiology of gastric emptying is concerned, this has been understood for a very long time, and fluids leave the stomach very rapidly, exponentially. The more you drink, the more rapid the clearance is, and the half-life of clear fluids in the stomach is between 10 and 15 minutes. Here's an exponential decay curve for a patient who's drank a dilute carbohydrate-containing beverage. Within 10 minutes, the volume is halved, and with another 10 minutes, it's halved yet again. Another myth which is commonly believed within the anaesthetic community and the nursing community is that adding milk to hot drinks like tea or coffee significantly slow the rate of gastric emptying. When that is subjected to clinical scrutiny, it's found that there is no evidence that it does. Here's 2 curves of patients either given black tea or tea with 50 mils of full fat milk, 50. Much more milk than most people would have in their drinks. And you can see there is no difference in the rapid emptying of these fluids. Most patients in the UK prefer milk in their tea and coffee, so there's no reason to restrict that. So where did the SipTilSend idea and movement come from in Tayside? It started with an audit of CPOD patients by my colleague Hannah Watson, who's the National Emergency Laparotomy Coordinating Nurse in the region. And she found the mean fluid deprivation time for these patients was 7.5 hours, with a maximum of 22 hours. Many patients experienced repeated fasting episodes when their operations was postponed, and there was lots of misery, morbidity, and unhappiness. Of course, our national guidelines and local guidelines were in line with everybody else's, being 2 hours. And if we could stick to 2 hours, that would be fine. But we, like everybody else, failed to do so. So we discussed at a consultants meeting and discussed opportunities to actually break this once and for all. And I came up with the idea of going for SipTilSend based on some of the comments I've already made. I organised a survey of my colleagues, and of the 106 anaesthetists, 81 responded to two simple questions. Number one, would you be happy for patients to sip water and clear fluids from an NHS glass, which is up to 170 mils per hour? Yes, said 90%. Number two, would you be happy for patients to have a cup of tea or coffee with up to 15 mils of milk on the morning of surgery? Yes, said 88%. So now we had a mandate to take this a little further. We were invited to submit an SBAR, Situation Background Assessment and Recommendation document, to the Anaesthesia and Intensive Care Clinical Governance Committee. I'm happy to share these documents with you if you think it'd be useful. And it was rapidly passed unanimously by that group. But that wasn't the end. There were further stages to go. We talked extensively to nursing and surgical stakeholders and to raise the awareness of SipTilSend and what we were proposing. Meanwhile, it had crept into routine practice in areas in which I work, such as the orthopaedic trauma list. And you won't be surprised to hear that it was extremely well received by nurses, patients and clinicians, with little or no dissent. And we've been doing that for over a year in orthopaedic trauma. The three members of our team who are on the steering group for SipTilSend, myself, Carol Gray and Hannah Watson, and we recognise the need to control this process and get full approval from the Clinical Governance Committee of the NHS Tayside to organise a coordinated launch. In October, we went through the second stage of clinical governance, which was the Clinical Guidelines Group, and I presented to them and again received unanimous support from that committee. The final stage was to update the NHS Tayside Fluid Food Nutrition Policy and submit that with the support of the Clinical Guidelines Group Chairman to the NHS Tayside Clinical Governance Committee, which is essentially the NHS board. And I'm glad to say they fully approved it on October the 7th. So we had final approval from the Trust, and we'd updated the relevant documents so we could plan our launch. Again, we discussed with a wide range of stakeholders, and we recruited up to 30 SipTilSend champions who are staff who work on the front line in the wards, in the clinics, in the waiting list areas, to help us spread the word. We also engaged the help of our NHS Tayside comms team to get the message out. Marketing, we know, is very important, and we developed a logo, which we're happy to share with you because we think it's a useful way of spreading the word. You'll see the logo says SipTilSend, note the spelling, with the slogan simple, safe, kind. And we launched a Twitter handle @SipTilSend, and this became a useful forum for sharing the message and ideas with people throughout the world. And we've had interest not only from Scotland, England, Ireland, Australia, the world. We put data on the NHS Tayside intra and internet about SipTilSend, and we updated all the relevant patient information materials. That's quite a bit of work. We developed posters, flyers, frequently asked question flyers, t-shirts and lanyards for our SipTilSend champions. We produced an audio clip, which you'll hear in a minute, and a short film.
Hi, I'm Dr Matthew Checketts from the Anaesthetic Department of NHS Tayside, and I'm here to tell you about the SipTilSend project. SipTilSend is an exciting change that allows patients to continue sipping water right up until the time they're sent for their operation. Up until now, we asked folk to stop drinking for about 2 hours before their operation, and sometimes it was a lot longer than that. SipTilSend ends this and allows everyone to stay hydrated, and we think it will reduce some of the stress and worry of waiting for your operation. SipTilSend is simple, safe and kind for patients and comes into place throughout NHS Tayside on Monday the 6th of December. Thanks for listening.
Here's examples of our marketing materials, the SipTilSend information, the SipTilSend frequently asked questions. And again, I'm happy to share these documents with you. This is the graphic that we updated in the Your Visit to Theatre patient information leaflet. This is given to all elective and planned patients at the pre-assessment clinic. And you can see it's a 3-stage information graphic. You should continue to sip water or clear fluids. Keep drinking any of the allowed drinks once you've stopped eating. We haven't altered the eating fasting guidelines. And when you come into hospital, you are encouraged to sip water until you are sent for your procedure. SipTilSend. So, Tayside conquered, launched on the 6th of December this year. We have lots of interest from my peers in the Scottish Hip Fracture Audit and a number of other hospitals throughout Scotland of adopting this. And I know other centres such as Glasgow Royal Infirmary are well on their way of introducing SipTilSend to their institution. I've had contact from several large trusts in England and Ireland and even Australia. So I think this movement really has momentum and ultimately will become the new norm sooner than you think. What a fantastic change. What a great improvement in patient preparation. We of course have support from the Chief Medical Officer of Scotland and the Clinical Director for NHS Scotland, Jason Leach. We've had positive discussions with the Association of Anaesthetists who are interested in this change and have asked us to contribute to a working party that will update existing preoperative fasting guidelines. Momentum is certainly growing. But what really counts to me is the patient experience. And here's an example of a patient feedback that was sent to me by one of our senior charge nurses in orthopaedics very recently. This was a patient who had a hip fracture and was really well managed at NHS Tayside 9 Wells Hospital. The daughter of the patient was a nurse who was obviously aware of the Scottish Hip Fracture standards. And one of the things she said in her feedback was, the clinical care was excellent. Mum especially appreciated the SipTilSend initiative, being able to keep her mouth comfortable right up to the point of theatre. It made such a difference to her. For me, that says it all. So we would love to help you adopt SipTilSend in your hospital. And if you want to learn more about this, get in touch with us. We'll support you in any way we can. And I'm sure you've got quite a few questions you'd like to fire at me now. Thanks for listening.